Okay, looks like I have another tricky biopsy case here. Not really sure what's going on with this one. Looks like we got some areas that almost look a little bit papillary. Looks like there's some hemorrhage associated with it. This weird hyalinized stroma. Oh, some of these lung biopsies can be so tricky. Well, I got this new book. Let's see, where did that book go? Oh, yeah, it's this like thoracic book written by Sanjay. I wonder what they would say about this lesion. Because I was thinking I might just order a Vimentin on it, but I wonder if there's something else I could do. Oh, there's Sanjay. Sanjay, what would your book say that I should do with this?
Thank you, Matt. This is a great book to have by your side. And Vimentin, never for anything. But you do need some immunostains here. Is this biopsy from a woman?
Yeah, this biopsy is from a woman. Yes,
All right. So,
I think
like
she's
our book
younger too.
says, this is a great clue if the biopsy is from a woman and has these features. So, a couple of things that I noticed, Matt. So, if you can point to it, there is an area of sclerosis on the right hand side of the biopsy,
I think there's some over
right
here,
there.
right? Yeah,
Yeah,
that's
little
great.
bit of sclerosis. There are some foamy macrophages at the bottom, detached foamy macrophages. Yeah, like there. And then the cells themselves are a bit, although it's cellular, it's not all that malignant looking. So
Yeah,
cytologically malignant,
see
right?
that? Yeah, yeah,
Yeah.
see that?
And then, Matt, if you just stay in this field, you'll see that on the left hand side of the leftmost fragment, there are some hobnail looking cuboidal cells.
Yeah,
And if you
definitely.
keep going down that, yeah, like that guy there,
Yeah,
that almost look like reactive type 2 pneumocytes. They're big and funky looking, but they have
yeah,
small nuclei,
agree. Yeah, definitely see that. Thanks.
correct? And then if you look in the stroma under it, like the interstitium, you've got these bland cells in the interstitium in there,
Yeah,
just below those hobnail cells,
yeah,
correct?
definitely. Yeah, I see those. Yeah.
So if you read our book, you'll see that there's a section that describes the two cell population in this tumor. And I suspect that's what this is.
Did you want to show that figure from the
Yeah, let
book?
me share it. So I'm going to share screen now. And let me know when you can see it, okay?
I can see it.
All right. So here's a picture from the survival guide book. As you can see in A, we've got the same two cell population that you have in your biopsy. So
Yeah,
there's a stromal cell population that the that the small arrow shows. See these bland cells in the interstitium?
yeah,
And then we've got those type 2 pneumocyte looking cells on the surface, the so called surface cells
yeah,
that
definitely.
the longer arrow points to, right?
Yes.
And then part B shows the same thing at higher magnification, but with the sclerosis, same as your in your biopsy. And part C shows the two stains. So I would suggest that two stains would really solve your problem, and that would be a TTF1 and some sort of a cytokeratin stain, A1A3, pankeratin, CK7. So part C shows you a TTF stain. And when you do your TTF on your biopsy, what we're expecting is that both the surface cells and the stromal cells will be positive for TTF1. So in other words, all the cells of interest will be positive. But when you look at your keratin stain, which is part D of the picture, you'll see that the surface cells stain strongly and diffusely, but the stromal cells are either negative or weakly positive.
Yeah.
So there's a dichotomy when you do the keratin stain, but everything is positive on the TTF1 stain. So do you want to do those stains and show
Yeah,
it to me?
let me see. I think I have those actually.
Oh, okay.
Let's see what I have here. Okay, I'm just gonna switch over here. So you can see my screen there.
I can, yeah.
I think luckily, I think a very intelligent resident had done some stains on this case, and
Oh, wow.
here's my nice cytokeratin, and very similar to the case you showed, I have the lining cells that are staining, but these round cells in the middle are really not staining, maybe a little bit of weak staining, and
Yeah.
then but the TTF1 is highlighting everything, both the surface cells and round cells.
Yeah,
So
I
I think
think
this does fit for sclerosing pneumocytoma.
correct, which would be a really good diagnosis to make on a small biopsy,
Yeah,
because traditionally this thing has been made on resections,
yeah,
surgical resections, lobectomies, wedge resections. So if you can make a benign diagnosis on a small biopsy like you're doing here, I think you can do a big favor to the patient and help out the surgeon in terms of management.
That's really helpful. Did these things get used to be called sclerosing hemangiomas?
Yes, correct. Yeah, that's exactly right. This sometimes when you look at a resected specimen, you'll see that they sometimes have these big blood-filled
Okay.
lakes in them, which can look like vascular spaces. So initially, when Dr. Lebo described this in the way back in the 20th century, he made a great observation that this was a unique tumor. But without the benefit of immunohistochemistry, there was no way to prove that this was vascular. But it looked vascular, and there was sclerosis, so it was called sclerosing hemangioma. Now, of course, we know with immunohistochemistry that these spaces are not vascular.
Yeah. It's in a weird staining pattern though. These TTF1 positive cells that are negative for pan-keratin, you know, do those represent any normal cell in the lung? Like what are these?
I don't
What are
think so,
these?
Matt. I mean, I think there's a little bit of a controversy, or you could say a gray area or a hole in our knowledge here. The surface cells do have the phenotype of normal, alveolar pneumocytes. They are TTF positive and keratin positive, just like alveolar pneumocytes would be. But I think the WHO considers this part of the tumor. It's actually a
Hmm.
second. So the two cell population, the assumption is that that's the second cell part of the tumor. But the immunophenotype is identical to normal alveolar pneumocytes. But your point is well taken. The stromal cells, like the round cells in the
Yeah,
interstitium, there is no counterpart to that in the normal lung. There's no cell that is strongly TTF1 positive, but completely keratin negative, or only weakly keratin negative. So
yeah.
there's no great counterpart to that in the normal lung. What do you think, Matt? What's your idea about what these cells might be?
It's probably maybe some immature precursor that then expands from from embryonic remnant or something, or some cell develops a premature phenotype and then is positive for TTF but negative for keratin. But I
Yeah,
suppose it's hard to prove that.
hard to prove,
Yeah,
but I think that's yeah. It,
it's it,
it's fair to assume that because it's TTF positive, there's something vaguely epithelial about it.
exactly. Well, I think this is a really helpful case, and I'm really glad that I had this book that could help me walk me through some of these challenging biopsy specimens. And if you're interested in checking out, you should check it out. It's coming in Preston sometime in 2022. Um, yeah, and thanks everyone for watching this, and we hope you also learned something as well about this rare but important entity.
Thank you, Matt.